take about 10-15 minutes, which sort of gives the principles of the program,
Okay.
and gives you sort of some ideas of what is required to make applications on behalf of the families that you're supporting, basically.
Okay, perfect.
So should we
Yes.
do that?
Yes.
Okay.
Cool.
So I'll just, would it be an option for me to share? Yeah, I am allowed to share my screen on this, aren't I?
Yeah, I've just, yeah.
Okay, great. So I will start with the screen share. Let's try and get this to work. It's just taking a second. So yeah, to give you some background about the program while this is loading for me. So I'm the partnership manager for the BBC Children in Need Emergency Essentials program. We started delivering in 2018. It was June. And we took over from the previous provider. So I work for Family Fund, which is a grant provider in its own right. And we took over from Buttle UK, who used to deliver the pot, that what is Emergency Essentials Programme. We receive 3.2 million each year now, but fortunately, this year we have received additional funding, which is great, because it's always a stretch to make the 3.2 million go across the UK. And it's great to have received donations from the BBC's Big Night In, which happened in April. So we got another £1 million or so to help with the current pandemic, which has been brilliant. It's really been a lifeline for us. And the government has also match funded that money. So we are in a very good position this year, which is really great to say, because obviously we want to try and reach as many families as possible. And that's enabled us to do that, which is fantastic. So I'll just take you through. Please feel free to ask any questions as well. But yeah, the BBC Children in Need Emergency Essentials Programme. So we are separate to the main grants programme. The main grants programme obviously funds projects and organisations, whereas we are different to that. So we provide direct support to children and young people, but we need your help as practitioners to get that support out there. So I'll take you through a little bit more about the programme. So members of the public are not able to apply directly. That is a key thing. So we need our practitioners to make, our referrers to make a quick 10-minute application on their behalf, and we do the rest. So the purpose of the programme is support children and young people facing exceptionally difficult circumstances. And it's to meet the basic needs. So it's, a hot meal with a cooker, or it's a bed, safe place to sleep, the basics really, or a washing machine, just so the child can have clean clothes to go to school. We do emergency clothing as well. So there's just some of the things, but in the main, those are the stuff that we get asked for the most, I'd say. And applications need to be made by a registered referrer, as I said. So once you're registered, so the individual employee registers on behalf of the organisation, and you can have as many people registered as you like. It's just that's the way our system is set up.
Because we've got a team of people, I mean, it may be, I'm just trying to think, instead of lots of people in the organisation registering, if you could just have a couple of people. If they put in multiple kind of, if they were then the people in the team making the references, you wouldn't look and think, oh God, they've had a load of stuff already.
No, not at all. I mean, organisations do it differently, to be honest. And yeah, in the main, I do see that they probably do have selected employees who make the applications, whether it be whoever that lead is in the organisation. And they then make the applications on behalf of the families that are being supported. But I got asked this morning, actually, because I was speaking to a lady, a health visitor, and she said, I try not to make too many applications to you, because I want to make sure that, we're using a cocktail of funders to make sure the money, charities' money is going as far as it can. But, like I said to her, the money is there to be spent on families in need, and we wouldn't, we don't limit organisations to how many applications they can make. You can make as many applications as you wish. It depends, it's all about the need, isn't it? So I wouldn't worry about that. Obviously, we've got mechanisms to ensure that the money is going to go as far as it can. But you can make it. You can have as many referrers as you like and how you would like to do it. The one thing we do say is we do need an organisational contact. So that is as part of the registration process, but you will find that out. I'll take you through the registration process in a second. So the whole point of the programme is to improve children and family well-being overall, really. to, you know, reduce parental stress. Although we don't provide items for parents, but you know, inherently that does, you know, obviously the child having a bed or them being able to wash their clothes does relieve some stress.
So a domestic violence family who had to be rehoused in an emergency could get bedding and equipment for the kids. Right. That's
so
fine.
that is our main reason for application on the fund, to be honest. It has been since 2018. Obviously things you know are getting a lot worse out there, so but yeah, we do see that as one of the main reasons for application, along with homelessness, to be honest. At the moment those seem to be the themes, but just the pandemic crisis itself. So I'll talk to you a little bit in a minute about the update on our coronavirus response as well, to give you an idea of that too. So that's just an overview. So like I said, these are the things that we award in the main. So you're talking about your cookers, your fridge freezers, washing machines. Beds is the number one. But saying that, we did see a change. So during sort of lockdown, the first one, we did see a little bit of change in what people were asking for. So the beds, sort of, we didn't get as many requests for the furniture and the beds because people weren't moving, obviously. We were seeing more for refrigeration, washing machines and cookers, because you know, we saw a lot of families who were just managing without cookers, for example, who were maybe relying on school, you know, breakfast club, school meals, and then maybe going to a family member after school because they didn't have a cooker. But with you know, with us not being able to enter into other people's houses, you know, that support wasn't there. So we saw a number of applications for cookers and things like that.
For something like things like fridge freezers and they're easy, you can just take them in the house and plug them in. Obviously cookers are slightly different. Do you also cover the installation?
We do. Well, we're a direct delivery model. So we have
you supply it to get it fitted.
We do it all. So you don't have to worry about
so we don't have to worry about the finance or spending it or making sure it's spent in the right area. That's brilliant.
But the only thing I will say on that is at the moment we're having difficulty with our clothing vouchers. So our supplier is not supplying them, basically. So at the minute we're having to use backs as an award to an organisation, and it's our only mechanism of getting that support out there. So at the moment, backs payments are being made for emergency clothing, and that payment has to go to the organisation. It's part of our terms and conditions. So apart from that, everything else is direct delivery. We've got a furniture supply, and I say furniture, they sort of do everything that isn't a kitchen appliance or a white good for us. And you will see on the application form that there is a drop-down list with listed items which you can just pick from and have a look at what we supply there. But I think that we get asked a lot if we do flooring, and we don't. We stopped doing it because it become unsustainable to actually provide. I think we supplied it for about 6 months, and then we forecasted that essentially it was either one or the other. We could either supply the flooring needs to the UK, or we can do the other things, is what you see on in green there. So we made that difficult decision to remove flooring as an item from our fund. We can't do items for parents. We do get asked, but we always have to refuse that because the money from BBC Children in Need is set to go to children, essentially up until the age of 8. When they become 18, they're no longer eligible, and that's how it is. So housing costs, laptops, technology, all of that. I will say though, so section 8 in the referral guidelines is where you'll see the full list of exclusions, but to be honest, there's not much there really more than this. And you know, it's, you know, we're quite open to what we can do as long as it's within the spirit of the fund. I would say take a look at that section 8. But back onto the laptops and technology. So we were really fortunate, as I said, to get some additional funding from the Big Night In. And as a result of that, we were able to provide digital items to children between June and September because the money went. So we had a ring fence pot essentially, but it went in 2 months. We are, you know, working with the fund, BBC Children in Need, to see if there is any way we could find some additional money for these type of items. But, you know, as it's not something we we don't normally do that type of item. It's always been an excluded need. So, you know, just bear with us and we'll see if we can open that up again, but it's still in the early stages yet, really. But at this point in time, we don't. But when we do, you know, if you're a registered referrer, or, you know, if you check out our website, I will send out a communication to those who need to know about it if it does come back on. Okay, so watch this space. Things change all the time and we get different funding from different places. So we're constantly trying to be responsive to the need out there. But in the main, we're sort of, you know, your basic essential type of provider. So just to touch on access criteria and eligibility. So age, as I said before, so as soon as the child becomes 18, we cannot provide a grant to them. And the child needs to be here as well. So we can't accept applications on behalf of unborn children, unfortunately. It's, you know, but as soon as the child is born, make an application and I'm sure we can get it turned around in a week. So hopefully. We do have a rule where we say one application per household in a 12-month period. However, there is discretion with that. If there's a new crisis, then we have been able to accept a second application in that time. Residency, so UK or EU citizen who is normally resident in the UK and they need to have leave to remain or refugee status. Income criteria. So unlike other funds, some funds stipulate that you need to be on a means tested benefit. That's not the case with the Emergency Essentials Programme. We just accept that our referrers will check to see that the person is, you know, on a very low income, and that would allow them to be able to apply. So as with all of the children in need funding, we're not there to replace any statutory funding where that should be or should exist. We're not allowed to do that. So we ask our referrers just to confirm that you've checked that there isn't any pots available anywhere else and that we're your fund of last resort. So just confirm it to us and that'll be all we need. So vulnerability and crisis. So those first things I just spoke about then are the access criteria. And then we've got the next bit. So the next bit is the vulnerability and crisis. So being on a low income alone cannot be a reason for application, although we accept, you know, poverty is, you know, it's a real problem, but everyone who can apply to this fund will be on a low income, so it can't be the only reason. So with that in mind, here's some examples of, you know, what we see as a vulnerability day in, day out, and that is domestic abuse. As I said, that is the main reason for application on our fund. And then I would say we receive a number of applications from children's services departments, early help teams who are trying to, you know, ensure that the children and the family have everything they need to be safe. And we have a number of applications for children in temporary accommodation or moving or finding, you know, families finding new homes. Those seem to be the main reasons. And then what I did see a change in, so we obviously report on outcomes, and in our outcomes I saw that there was a huge increase in applications made for you know, family units potentially with a member of the household with a seriously serious chronic illness or mental health, and we saw that rise obviously during the pandemic. So another reason. It doesn't have to be the child who has the health condition. It could be the parent or carer, and it's just about what, you know, what impact it all has on the children in the household, really. And then, yeah, the crisis element. So we need to know, you know, what will happen if the child doesn't receive an award, and there needs to be, you know, demonstration of there being immediate need and risk there, basically, which I'm sure, you know, is easy to convey. Unfortunately. So the process. So just a little map here. It's very basic, but we've got the family or young person there. Go into the referral agency yourselves. You're a registered referrer, so you make the application online on their behalf. Our team assesses it within 5 to 7 days. Normally is the turnaround. Sometimes they can be quicker, or sometimes they can take up to 10, depending on information required and things like that. And then once granted, and we decline around, I think it was 12% of our applications would decline last quarter. We don't like even declining that many. So we try, we don't like saying no. But, you know, I'd say that's mainly access criteria is what those declines are, to be fair. The vulnerability and crisis element is so important within the application form as well. So yeah, so that goes to our supply chain, or in some circumstances when we've got a vast supply chain. Family Fund Business Services does the fulfillment for the BBC Children in Need Emergency Essentials programme, and they have a number of suppliers. But on this one, we use a white goods supplier UK wide, and we use another supplier who does all our furniture bits and all that sort of stuff. Anything that you see that is in a white good basically are done by them. They've got warehouses all over the country ready to supply every area in the UK, and Walsall's not going to be a problem whatsoever. So yeah, when we can't use that, we have to use backs, unfortunately. And the clothing, you know, we're trying our best to get that back on to be clothing vouchers which go directly to the beneficiary's home, but it's just not happening at the minute. And as soon as that does happen, we will let everyone know that it's back on. But if you can accept, you know, the current offer, which is backs to your organisation, then we can still provide that. That's not a problem, the emergency clothing. Okay, so referral registration requirements. So as I said, you have to be pre-approved before you can make an application, and to be honest, this can be the longest bit of the process, because we need to check with your organisation that you're okay to do what you're doing, and yeah, there's checks, and it's not a computer, it's people. So we've got, you know, it can take a good week to 2 weeks at sometimes to get yourselves registered. So I would say get registered just in case you need to make an emergency application. But yeah, we try to turn it around as quickly as we can, but we do require the line manager authorization as well, and that is, you know, that requires a person to respond to. So, you know, we've got all these bits in the process there. So yeah, it's online, everything is online. We don't have a paper application form for any of it. So if you do need any support with it, just let us know, and we've got a team there to help. And we can help you with that. But yeah, I'd say the only thing that prevents some organisations from registering at this point in time is the email address requirement. So we need you to have your individual employee email address, and then we would need your line manager or suitable secondary contact to have a different one to use. So you can't use a shared mailbox. You know, you would need to use one which is affiliated with your organisation. But we can, you know, if there's any concerns over whether or not your email addresses are going to suit, you can just drop me a line and we'll just chat about it and work out if it's going, you know, if it's going to be okay. It's not a problem. So the grant application. So as I said, it's online, and once approved, you can log into your own dashboard. It's your dashboard once you're registered, so it shouldn't be shared with anyone else. And then within that is where you make your applications. Really simple and easy application form. I'll show you what it looks like in a moment, but yeah. And then the assessment can take up to 5 to 7 working days, but it can be 10. That's as long as we can take, and it depends if we need more information. Hopefully we won't, but yeah, that's the only thing. And it's so we communicate the decision via email after, whether you've been declined, hopefully not, or you've been approved. And then that email will also contain information about the supplier and next steps too. But you know, we're always here to answer any questions. The fulfillment process. So as I said, so all appliances, kitchen appliances, will be delivered directly into the beneficiary's home. We have got the with the supplier, they do remove items as well. So they do the installation, they remove, they recycle. That's what I was looking for. They recycle the old appliances. Yeah, so we've got all that in place with the direct delivery model that we have. And yeah, the furniture, it's all delivered, usually a 2-man team, I think, a van. So yeah, all delivered directly to the beneficiary's home. You can't, so the way that we work with our suppliers is we have, so the items that you see on the application form are what we do. So we arrange sort of every couple of months, we do a check with them to see what they can provide. So if we need a table and 4 chairs, for example, there'll be a specific one that they're going to supply us for the next couple of months. And the same with our cookers and things like that, because we've had an issue actually in the last couple of weeks, all sorts of things in our supply chain, but the end beneficiary never sees this. We weren't able to supply the normal cooker that we do, the electric one, because there's a global shortage. And so we found a different one, and it was basically, we did a 2 cavity instead of 1, which is what we normally do. And those are the type of solutions that we have to find day in, day out at the minute. So yeah, so we do, you know, no one sees the end thing. Obviously, there was no delay to any of our beneficiaries, but we just switched like that. So, but we can't choose. We're not able to provide any choice of items or show you what item it is. It'll just be a specification or a description, if you understand what I mean. So the online application, here it is. So here's the website. Essentially, we've got a new picture on it now. But yeah, you would use this this URL to get onto the website. And I would always recommend, when you're making your applications after you're a registered referrer, to always go in via this bit, because it prevents any links from expiring or becoming useless after time, basically. So that's what I would recommend you do. And this is what it looks like. So essentially, it's a series of tabs, and you go into the declarations. So in the declarations, you're confirming that you've got consent to make the application on behalf of the beneficiary. It has all of the other bits and bobs that you would agree to before you go on and make the application. We then ask for the child and contact details. So the contact details there, that is the parent or carer. So yeah, and your details obviously pull through anyway into the application form. So yeah, data there that we need, and then access. So the access is a series of tick boxes, and if we think back to the access and eligibility slide, that will be, so the date of birth is one access criteria, and that is captured in the child and contact, so we know how old the child is. Access, then you confirm that they meet our residency criteria by a tick box. You confirm that you've exhausted all statutory funding, and there's a couple of other things there. They're just tick boxes that we ask you to do to confirm. The next tab, so that's your writing bit, eligibility. So the eligibility tab is the vulnerability and criteria write-up. So we don't ask for war and peace, we don't need that, but we need some basic, details about the circumstances, whether it be domestic abuse. We obviously don't need detail, we just need to know, the circumstances around, the child and the parent there, or the carer, and yeah, the crisis. So we need to know what will happen if the child doesn't have an award, and the immediate need for that family there. Yeah, and that's it really. That's all we ask for. Grant processing, so that's where you put your items. So we've got an items table. Now I will be honest, 50 applications a week are put into a queue for further information, and that is because the table hasn't been filled out. So the referrer is not provided a list of the items, essentially, or put them in priority order. So we ask for you to fill out the table using the drop down and pick the items, but also to put priority need. And that helps us to be able to balance, we will award as much as we can within our funding availability. At this point in time, we can do 1 kitchen appliance or white good per household, up to 2 items per child. So items, other things, your beds, your other things, bed bundles, things like that. But you'll see probably, what we can provide. But yeah, at this point in time, we're able to provide up to 2 items per child, but we still have that 1 white good rule on the fund.
So Gemma,
yeah.
If in a case of a domestic violence, a family's had to be rehoused, and say there's 3 children, are you saying that's 6 items?
Potentially, can be. Yeah.
That's fine.
But only 1 white good.
Yeah. But obviously, 1 white good. So it could be the cooker and or fridge, but you can't have both.
That's correct. So you could put them down, but you would have to put them in priority order. And at that point in time, if we still had the 1 white good rule in place, then we would take whichever one you've put as priority, number 1 over 2. But if that changed, and if we suddenly got another 5 million maybe in our funding pot, then we can be a little bit more generous, can't we, with our awards, I guess. But yeah, so I would always, don't strictly keep it to the 2 items, because
no,
it changes. Our funding changes, doesn't it?
And it is a crisis when somebody's moving into a new property that's through DB,
definitely,
they've got no equipment,
got
and we're having to try and find a cooker and the fridge freezer.
It's so hard, isn't it?
And the washer. Okay. I mean, we use a charity called Acts 435 as well.
Brilliant.
For funding pots like that.
Yeah. So I have a monthly call with the team at Buttle. I don't know if anyone uses Buttle UK as a grant provider, but if you're supporting families who are fleeing domestic abuse, then that is also a potential funder that you can use. Chances for Children, it's called, the project. Fantastic. Pretty much the same as EEP, same turnaround times, but they only support 3 main groups: kinship care, care leavers, and families fleeing domestic abuse. So give them a try too. We work together with a number of other grant providers to make sure that we're spreading the word about everyone, because you need to use a cocktail of funders these days, don't you? That's the thing.
Can I ask, Gemma, you kind of, or I'm not sure if I just optimistically heard, I was thinking about beds and thinking, I mean, a bed's kind of not just a bed, is it really? Because you're kind of thinking then also it's a bed, a mattress, and a cover.
Yeah.
And you mentioned a bed bundle.
We call it a bundle. We call it a bundle now. So the problem is, so every little bit is on our system. So like when you go on grant processing and you see the items table, you will have to, I'm pretty sure there's an option of bed and mattress. There's an option of different frames. There's an option of different mattresses.
Okay.
So and then you would please add the bed into it.
Sure.
Which is your bedding bundle. It comes with the duvet covers and all that. Our supplier's done a really good job with that, to be fair. It's really nice.
Okay. Yeah.
So just add all the bits on that you need. We call it a bed bundle because it's not a cot bundle, but it isn't called that on the system. But each item is separate, so you have to stick them on basically.
That's great.
Yeah. Or they might not need the thing is we need to be flexible because they might have a bedding, they might have a mattress. We see that, or they've got a bed frame, and our referrals are really great in that they understand that funding is limited and they want it to go as far as possible.
Sure.
So if there's a bed frame, that's fine. They'll just ask for a mattress, which is great. And if they've already got bedding, so just it's there if you need it. So that's sort of the message. But we would class that as one thing. We wouldn't say the child can have a bed and bedding, and that is your 2.
Okay.
We expect it to be a full, the child can get into bed and go to sleep, basically.
Yeah, that's kind of where I was at with that.
Yeah. So we get the furniture requests we get, I think, are mainly for drawers and wardrobes at the minute, to be honest. You couldn't have both. It'd be one or the other of those. Unless that's all you're asking for, then you could have both. But if you're going for the bed bundle, should we call it? That's what we call it internally. And you wanted a wardrobe or drawers, then you probably need to prioritize. Put them down, but prioritize. Do you want the wardrobe or the drawers more over the beds? Okay. That's all really. Yeah.
Thank you.
And if you ever want to chat anything through, just get in touch. It's not a problem. So I just thought I'd give you an idea of what we need, again, in more detail. So hopefully this presentation will be circulated, and obviously my details are at the end. But this is essentially what the form is, what we just looked at, each of those tabs. And I think it's useful to have this information before you make an application, or before you speak to a beneficiary about getting the consent to make the application, because then you've got everything you need to make the app, basically. So but obviously that will be circulated, but that's essentially what we were just talking about, but in more detail. Oh, forgot one thing, a key thing. There is no save and exit facility on this application. Very sorry about that. Something that we're trying to work towards. So I would say, which is why this having this information before you start is important, to have the checklist. The main body of writing is the eligibility tab, 2 paragraphs, 2 questions. Statement regarding vulnerability and crisis, and then a statement regarding the unexpected circumstances. It should only be a paragraph for one and the other. That's normally, I'd say, what our referrers do. So you don't have to go too mad, but we just need the basics. So maybe it could be an idea to do that in a Word doc first, because that'll be what you will lose. The rest of it is just data entry and tick box. So I would recommend you do that while we're working on potentially improving our our dashboard. So our decision makers, there are a few of them. They don't look, so we train our decision makers not to look from a perspective of declining, so not to look from a negative perspective, but to always when they receive an application, the person is eligible because it's come from our registered referrer network, professionals who are dealing directly with families for one. Unless it's access criteria, then we can't do that. But in the main, they look to grant. They don't look to turn an application down. They will also seek further information if it's not there too. They try their best to get them all to go through. So yeah, we ask that you confirm that. So they sort of look at it in a process. So the system weeds out the access criteria, I would say, and then they're looking at the vulnerability. But also, so it might be good just to confirm in your little paragraph that, you know, the family are on a low income, but that can't be the only reason, obviously, that they meet the residency criteria. And I would always have a sentence just to say, this is you know, we are coming to you because there is no other support available from anywhere else. This is our last resort. And then you've covered off the main bits there. And then I would say always to focus on the impact that the item will have on the child, and what will happen if the child doesn't receive the item, as I've said before. Yeah, and then don't forget, vulnerability is a huge bit. So back to what we were talking about, what are the background circumstances over and above financial issues potentially, you know, and not being able to afford to get the item. What is there? What do you know? That's what we need to see as well. But as I say, we don't need to know full, you know, the full detail. Just you know, advise us what the potential vulnerability is there. So carpets and flooring, sorry, we don't do that. And then we can only do the one white good at the minute, or kitchen appliance. And then yeah, well, the application form. So originally it was one we used to ask our referrer network in 2018 to do one application per child, but you know, we got feedback to say that, you know, doing an application per child is not really good for us, and that's fine. So we changed what we do, and now we allow you to do one application per household. So you will pick, you know, so we ask for the child detail. You know, some people use the eldest child or the child that the you know, the grant will benefit the most, if that's you know, if that is a thing. I'm sure every child in the household would benefit from it, but yeah, so it's up to you which one you want to name as the named child there. And then we ask you to just give detail of the other children and what they need in the, obviously in the items table, but also in the main body of the eligibility bit too. And then we know the full household circumstances and who needs what. There shouldn't be a problem then. And then yeah, so we have a number of help desk queries for change of address requests. It's probably one of the main reasons why applications are not, you know, have issues at the end stage, which is the fulfillment and the supply chain, because people have moved and the application was originally made with the, you know, the address that they were at before. Our suppliers are not allowed to deliver to any address that isn't on that file, basically. And it will delay things because we would then need to get a change of address request over to them to allow them to release the goods, basically. So just keep that in mind. Sometimes it's better to wait until you've got the new address, or you've got, you know, you're pretty sure that they're going to go to that address. I mean, things, you know, we recognize that things aren't easy and that, you know, it changes. So, but it's just, you know, if we can prevent a little bit more, then that would be really great to have your help to do that. So yeah, our coronavirus update. So the team moved from our office into home working within about a week, when the announcements were made on the 23rd of March. There was no impact on our grant delivery, which is really good. We were still able to turn around the applications, and we still are, but we're all working from home. So we've had to switch off our helpline. We're not able to do the help desk, the Children in Need Emergency Essentials one, but we've got the whole team working on the emails inboxes, so we can be responsive on there instead. And we have just introduced outbound calls, so we're just getting that set up, and we should be able to provide a better service there. But as far as grant delivery and everything else is concerned, there's been no changes whatsoever. Some slight bumps, like I said, in the supply chain, but no one will have seen that. As in, it's not impacted the end user, basically. We just changed what we do. So the additional funding, I think we had over £1 million. It was definitely over that, and then it was match funded, which is fantastic. And that is what we've been spending recently. So we have added COVID-19 crisis as a reason for granting essentially on the system now as well, and I don't think that'll be moved for a while. I think it'll be on there for a bit. And then obviously, yeah, our suppliers are just, you know, we're working with them to make sure that they can supply what we need them to supply. And sometimes we've had to resort to backs, and that is with the clothing thing, which is a shame, but there's no other choice, unfortunately. And then, yeah, so that's our update. We've got, so yeah, get your applications in. We've got money to spend at this point in time, specifically for any vulnerable families who have been directly impacted by the coronavirus pandemic. But not only that, we've got our core funding as well to, you know, if that is not a reason for application, of course. So, you know, get your applications in. And that's it. So this hopefully this presentation will be shared with members of the network, and if anyone wants to get in touch, please do. So yeah, shall we move back to the screen, and then we can have some questions then, I guess. Okay, I think that's worked. So yeah, thank you for letting me do the presentation there. Is there any questions at all, do you think?
I've just got a couple, Gemma. Did you operate in Walsall already? Have you already got referrers from Walsall or not?
We have, but not many. Not many at all. We've got a few.
Well, I don't know if the other because I'm in the South and Central Early Help Hub, so I don't know if whether the other three areas. I mean, once I get this through, I'll circulate to them. I don't know whether they use you already, but
I could check. I know that the numbers aren't huge. I'll be quite honest.
Okay.
But yeah, it'd be really good
to have a look. I've written down probably 1, 2, 3, 4, 5, 6, 7 voluntary organisations that I could actually use the PowerPoint presentation straight away.
Yeah,
fantastic.
Show them.
Yeah.
These are teams of people working with domestic violence, sexual exploitation, drug and alcohol. You know, so you know, it was hitting me. I mean, I've made a few notes. Did you say it was Buttle UK? BUTTLE?
Yeah, that's correct. Buttle UK Chances for Children program specifically would help families fleeing domestic abuse.
Yeah,
they have 3 main groups that they will use, and they don't mind me promoting them at
all.
No. We work together, so it's fine.
Yeah, it's fine.
Go for it. There's as well as, do you use turntous.org.uk, the grant finder on that?
Yeah,
because we're on it. You use that, great. We come up for every search, I think. We've set ourselves to do that, so but yeah, I mean, you'll be well aware of the local options, and you know, it's good to have, you know, a backup of a national program as well, I guess, for yourselves. So yeah, be excited to receive more applications. And I mean, you know, application volumes are actually down for us. We should be running at about 400 applications a week, and we're shy of that. So you'd think that we would be oversubscribed, but we're not. So.
Okay.
Gemma, I was going to ask, is this an ongoing program? Is it? It's not due to finish at any time in the foreseeable future?
Good question. So this funding has actually been around for 15 years, well, 18 years now. So it was 15 years when we took it over in 2018, and then we being Family Fund, and we're helping BBC Children in Need to deliver their program. It's very much their program, and their involvement is huge, obviously. And yeah, so we are in the middle of a 3-year contract. So we're in year 3 of the contract, and we're currently negotiating. So emergency essentials is going to be here. Yeah, is the answer, definitely. Yeah. Whether or not we provide it is another thing. But I think, you know, it's one of those. So we're just having conversations about that. But yeah, there'll be no issues. It will always be going. Yeah.
And statutory organisations can feed in. And Gemma, statutory organisations can be referrers, can they as well?
Yes, of course they can. So 50%, I had a look at our organisational split yesterday, and 53% of our organisations were from children's services and other. There was less involvement, I would say, from your revenues and benefits departments. That was quite low on the uptake, and the other housing departments and things were quite low, I'd say, on the programme, but mainly children's services referring. It's the early help, it's the children's centres, which are all classed in that banner. Yeah, so yeah, but yeah, I mean, with the funding, definitely 5 years, as in another 2 after this. But after that, it just depends, because it all depends on the donations that we receive. Well, Children in Need receive on the appeals night, doesn't it? Whether or not they can still commit to every program that they run. So hopefully, but yeah, and we, it was a great appeals night, a really good result, wasn't it? Considering the circumstances at the minute, and some fantastic money raised there. So it's great. Hopefully things will be back on track over the next couple of years.
Part of my network, because of me being in part of the Black Country Food Bank, I think you probably lost that when I went offline, is that I obviously look after the 7 food bank teams in Walsall, but we've got 19 other teams across Sandwell and Dudley. Right. So obviously I will distribute this to our head office in Brierley Hill in Dudley. Brilliant. Who are doing an awful lot of support work through COVID with Dudley Council.
Fantastic, yeah.
So they could, I mean, I don't know if Dudley Council are involved or, but it's about disseminating it across them as well.
Brilliant. No, yeah, you helped to get this out across the networks. We need to make sure everyone knows that this program is here, and that we are ready to help in these really difficult circumstances. Doesn't always, I mean, it doesn't, the immediate need is there, what you're doing there in the food bank, which is fantastic. We don't provide emergency provisions like that, the food or anything like that, but it's the stuff that maybe some people find I get feedback to say that white goods are quite hard to get hold of, across the country, really. So it's the program provides that opportunity, doesn't it? Yeah.
It does.
Great.
Oh, excellent. That's been really helpful. Thank you very much.
No problem. It's been lovely to meet you all today anyway.
And how will the presentation just arrive by miracle, or?
I've recorded this, so
Dave, David, you can answer that one.
I've recorded this whole thing, Morag, so hopefully I'll send the link to this to all of you. Gemma, if you could send me the presentation,
I'll send you the presentation.
I can send that out as well.
Perfect. And feel free to share it amongst the networks and organisations.
But we'll put it out in our bulletins and stuff.
Yeah. Fantastic.
I'm guessing that you work with. Do you work with Abdul? Also the South and Central One Walsall community link.
I work for One Walsall, so
because he's One Walsall, but he's down in South and Central.
Abdul works for the council. You've talked about Arfan.
Arfan, yeah, sorry, yeah.
Yes, Arfan works for us.
Okay, that's great.
We help support One Palfrey Big Local. So Arfan works for One Walsall, yeah.
Excellent. Okay, cool.
Hopefully everyone will get it.
Yeah.
Excellent.
And as well as, I can do more in-depth workshops